Hi, I'm Brent Stafford, and this is RegWatch by RegulatorWatch.com. Thanks for joining us today for this quick turnaround coverage of Health Canada's just completed webinar on vaping regulations. It was titled Regulatory Process: How Vaping Regulations Are Decided, Drafted, and Developed. It really was quite an extraordinary webinar, and kudos to Health Canada for providing some transparency to the process. And it is the process that they really wanted to share with Canadians. How does regulations get made in Canada? That was pretty much the topic of this particular webinar. And specifically, though, they did get into some details on where we are in the process of the proposed flavor ban that Health Canada has put on the table in order to help fight youth use of nicotine vaping products. So there were a bunch of questions that were presented to Health Canada before the webinar, and they were the ones that got to pick and choose which questions to present in the webinar and which ones that they would answer. So I leave it to you to decide whether or not they did a good job in the choosing and in the answering. So why don't we take a listen?
Welcome to this webinar on the regulatory process, how vaping regulations are decided, drafted, and developed. Bienvenue à ce webinaire sur le processus réglementaire, comment les réglementations sur le vapotage sont décidées, rédigées et développées. So my name is Sonia Johnson. I'm the Director General of Health Canada's Tobacco Control Directorate. Je m'appelle Sonia Johnson et je suis directrice générale de la Direction de la lutte au tabagisme à Santé Canada. To start off today, I'd like to introduce our panelists. Alors, pour commencer, je voudrais vous présenter les panélistes. And maybe I will first start with our guests. So maybe, Maria, I'll pass the mic over to you first, if you'd like to introduce yourself, please.
Thank you, Sonia. Hi, everybody. My name is Maria Bayawanu, and I'm with the team at Rights for Vapors. I am so happy and so grateful that Health Canada has taken the time to address consumers of vaping products in Canada. Personally, I'm approaching 10 years of being smoke-free thanks to vaping. And 7 of those 10 years, I've been working really hard to ensure the voice of the consumer is being considered during the process at every level of government. That is why this webinar today, brought to us by the team at Health Canada, is so important. And that they're taking the time to talk to consumers, to talk to us, to address some of the questions that we have and continuously asking in different forums and answers that we really don't know. I truly hope that this is step one of a much bigger vision of building a stronger relationship between consumers of vaping products and Health Canada, so we can build regulations that are fair to everyone. So thank you. This means so much to me.
Thank you so much, Maria. Christina.
Oui, moi, je vais m'adresser en français. Mon nom est Christina Xidous et je suis la porte-parole de la Coalition des droits des vapoteurs du Québec. Je suis une ancienne fumeuse qui a fumé pendant 25 ans et je suis maintenant sans tabac depuis 2015 grâce aux produits de vapotage aux arômes de fruits. Je suis une militante, une ancienne organisatrice communautaire et défenseuse de la réduction des méfaits allant de la consommation de drogue aux pratiques sexuelles plus sécuritaires et bien entendu en ce qui concerne la principale cause de décès évitable au pays, le tabac combustible. J'aimerais moi aussi remercier Santé Canada pour avoir accepté de tenir ce webinaire. J'espère que ceci présage un changement d'approche sur le dossier avec le but ultime, l'éventuelle participation et l'apport des usagers dans toutes les étapes décisionnelles, y compris l'élaboration de la réglementation, comme c'est le cas actuellement dans d'autres pratiques de réduction des méfaits en santé publique. Merci.
Merci beaucoup, Christina. I'll now turn it over to my Health Canada colleagues. Laura.
Sure. Hello, everyone. Great to be with you today. My name is Laura Smith. I'm the Director of Tobacco and Vaping Policy. Je suis la directrice de la politique sur le tabac et les produits de vapotage.
Thank you. Denis?
Bonjour à tous et à toutes. Mon nom est Denis Chouanière, directeur du Bureau de la réglementation des produits du tabac au sein de la Direction de la lutte au tabagisme. Denis Chouanière, Director of the Tobacco Products Regulator Office in the Tobacco Control Directorate.
Thank you. Sorry, just one second, please. joys of working from home, what can I say? Okay, so continuing on with our agenda. So again, we're very happy to be here today to speak to our work. C'est avec plaisir que nous vous parlerons de notre travail. So I'll just walk through the agenda that we have for today. So first, Denis Chouanière, who will be presenting an overview of the regulatory process, including the consultation process. Alors, pour commencer, Denis va présenter une vue d'ensemble sur le processus réglementaire, y compris le processus de consultation. So after this presentation, we'll have a question and answer period to respond to the questions that were provided in advance. Cette présentation sera ensuite suivie d'une période de réponse pour répondre aux questions qui ont été posées à l'avance. So we will be showing the presentation in both English and French. However, the questions and answers will be given solely in English. Les présentations seront affichées en anglais et en français. Cependant, les questions et réponses seront uniquement en anglais. And so before we begin, I'd also like to mention that the Government of Canada has committed to Article 5.3 of the World Health Organization Framework Convention on Tobacco Control. Avant que nous commencions, j'aimerais également souligner que le gouvernement du Canada s'est engagé à respecter l'article 5.3 de la Convention cadre de l'Organisation mondiale de la santé pour la lutte anti-tabac. So this commitment requires Health Canada to act and to protect our public health policies from commercial and other vested interests of the tobacco industry in accordance with national law. En raison de cet engagement, Santé Canada doit veiller à ce que les politiques de santé publique ne soient pas influencées par les intérêts commerciaux et autres de l'industrie du tabac, conformément à la législation nationale. So additionally, in keeping with our international obligations to the WHO FCTC, we'd like to inform you that this webinar is subject to disclosure as per Health Canada's openness and transparency policies. De plus, conformément à nos obligations internationales à la Convention cadre de l'OMS, nous vous informons que ce webinaire fait l'objet de divulgation selon les politiques de transparence et ouverture de Santé Canada. Therefore, nothing shared during this webinar is considered confidential and personal information will be disclosed without your further consent. Donc, rien dans ce webinaire ne peut être considéré comme confidentiel et vos renseignements personnels seront divulgués sans votre autorisation supplémentaire. Okay, perfect. Now, on to the heart of our discussion today. I'd like to pass the mic over to Denis. Et maintenant, la parole est à vous, Denis.
Merci, Sonia. Can we get the slides, please? All right, so this is a quick overview of the federal regulatory development process. Next slide, please. So what are regulations and orders? They're considered delegated legislation. That means that in the Act, Parliament has to provide powers for the Governing Council to make regulations. Otherwise, the Governing Council cannot make regulations. And when I say Governing Council, I mean Cabinet. Cabinet is all the grouping of the ministers of the government, and they act on behalf of the Crown. So the ministers will make regulations only in the areas that Parliament approve in the legislation. Parliament also has a joint committee. So senators and MPs sit on a joint committee that reviews regulations that have been adopted and will make comments to the government to correct regulations if they find that the Governing Council, so Cabinet, exceeded the powers given by Parliament. Donc, en français, rapidement, la réglementation, ce qu'on appelle règlement et décret, sont considérés comme des mesures législatives subordonnées. Et ce que ça veut dire, c'est que les lois du Parlement, certaines lois du Parlement, comme la loi sur le tabac et les produits de vapotage, prévoit certains domaines, certaines dispositions où le gouverneur en conseil, donc le cabinet, qui est le regroupement des ministres, peut adopter une réglementation. Et le Parlement a un comité mixte, un comité conjoint mixte, qui regarde aussi les mesures adoptées pour s'assurer qu'elles ne dépassent pas les pouvoirs que le Parlement lui a accordés. Next slide. So here's a very full slide that you can find on the Justice Canada website, and I won't go through it in details, but just to show that you need first a legislative process to allow Parliament to decide on where they want to give regulation-making powers in their legislation. Typically, these are more the technical areas. And then you'll see quickly here the main steps for the regulatory process, and we'll come back to that in a few moments. Donc, en gros, voici une diapo très exhaustive qui montre les différentes étapes pour la création de lois, et elle sert seulement à illustrer que le Parlement doit décider ensuite de quelles mesures réglementaires il va donner autorisation au gouvernement en conseil pour l'élaboration de règlements. On va y revenir en plus de détails dans quelques moments. Next slide, please. So Cabinet adopts directives on many areas, and they have a Cabinet directive on regulation, and that sets out the government's expectations with respect to the development and management of federal regulations. Cabinet, through this regulation, these directives, has also set out 4 principles that I thought would be useful for the participants today to be made aware of. Don't forget here that obviously for Cabinet, it's important that the Government of Canada respects Parliament authorities that are given in the legislation, and that overall for Cabinet, it's important to ensure that regulations result in the greatest overall benefits to current and future generations. Donc, la diapo ici, c'est pour vous présenter le fait que le cabinet a adopté une directive sur la réglementation, que pour le cabinet, c'est important que le gouvernement du Canada, à travers sa réglementation, respecte les pouvoirs que le Parlement lui a conférés. Et pour le cabinet, c'est important que la réglementation entraîne les plus grands avantages dans l'ensemble pour les générations actuelles et futures de Canadiens. Je vais maintenant vous présenter les 4 principes qui sont énumérés à la directive. Next slide, please. So Cabinet sees all the regulations that fall under what's called the Statutory Instruments Act. Sometimes there are minister regulations that do not fall under that, but let's say for today that all regulations go to Cabinet. Obviously, regulations are not always going in a single direction. There are aspects of regulations that may favor one area over others. And that's the role of Cabinet to balance the interest of Canadian society. And then Cabinet decides on which regulations go forward or not. So if you look at the first principle here, it aims to protect and advance the public interest and support good government. In this aspect, protecting the health and safety of Canadians is obviously an area that Cabinet wants to move forward with. So regulations made under the Tobacco and Vaping Products Act would fall here under this area of protecting the health and safety, but mainly health in the case of flavoring regulations, the health of Canadians. Second point is the regulatory process is modern, open, and transparent. And I'll insist here on open and transparent. So there are obligations put on the Government of Canada to make sure that when there are regulations that are in development, that it's communicated to the public and that the public mainly the interested public is aware of these consultations and are given an opportunity to comment on. Third one is that there's an expectation that regulatory proposals are based on evidence. That includes also a robust analysis of costs and benefits, and if applicable, assessment of risks. Finally, another point here that the cabinet has to weigh is also whether regulations will support a fair and competitive economy, and for example here, promoting economic growth, entrepreneurship, and innovation for the benefit of Canadians. Donc, brièvement en français, les 4 principes directeurs qui sont énumérés ici servent à guider le développement de la réglementation et les décisions que le cabinet va porter sur les projets de règlement qu'il doit considérer. Next slide. So there are many steps that bureaucrats must go through when developing regulations. And we've grouped them here just to facilitate discussions in 4 areas. So first area that we'll be seeing in a few seconds on its own slide is about determining the role or the need for regulations. Once you've done this to help cabinet, there's a requirement to develop a regulatory impact analysis statement. And then there's another major step is a step of drafting regulations and getting Treasury Board approval. And then the last steps include publication in Canada Gazette Part 1, followed by consultation. And then if Cabinet decides so, there's a final approval of the regulation. So let's go into details, and I'll give the details. Je vais donner les détails en français quand on ira à chaque diapo. Slide 7, please. All right, so as I mentioned earlier, Parliament has decided that there are some provisions for which regulations can be made to support the legislation. The fact that there are such provisions in the legislation doesn't mean that the government needs to develop regulations in this area. What's key here is you have to identify an issue that warrants intervention, regulatory intervention. So that's a main point here is there an issue and what is this issue? And if you've identified this issue, then an analysis you need to do is it the right issue for regulation? So in the case of the flavoring regulator proposal, there was an issue that was identified in 2008, further identified in 2019, basically based on the publication from the literature, also surveys where we got information about youth vaping, an increase, dramatic increase in youth vaping. And that was the start for us to identify the issue. Regulatory proposal was also developed because we thought that it was the best tool to be able to intervene. There's a requirement also that when government is looking or is considering regulation, that is communicated to the Canadian public. We do this through what's called a forward regulatory plan. This is posted on the Health Canada website. In this particular case, it was in February 2021, after there was earlier consultation. That was decided that, okay, we're going to go ahead and develop a regulatory proposal. Consultation prior to publication. So that's also a major point for the Treasury Board Secretariat. The Treasury Board Secretariat, if you want, is the department that supports the Treasury Board. And obviously the next question is, who is the Treasury Board? Well, the Treasury Board are the ministers that sit on cabinet that are named to one of the committees of cabinet that's called Treasury Board. And for a number of years now, Treasury Board is the approval body for any regulatory proposal. So before we can even take a proposal to Treasury Board Secretariat, we have to have a prior consultation. In the case of the appeal and access to vaping products area, Health Canada consulted in this area in April 2019, and I seem to recall it was for 60 days. So the results of that prior consultation was used to develop the proposal. En français, brièvement, et on doit d'abord déterminer s'il y a un enjeu critique qui doit être abordé au moyen de la réglementation. Lorsque le gouvernement décide qu'il veut proposer éventuellement une réglementation, ce sujet est affiché dans le plan prospectif de la réglementation qui est affiché sur le site de Santé Canada. Dans ce cas-ci, le projet de réglementer les arômes dans les produits de vapotage est affiché en février 2021. 2020. Non, excusez, 2021, c'était cette année. Merci. Next slide, please. So one main tool, or the main tool, if you want to communicate the proposal to both cabinet and the public, is through the regulatory impact analysis statement. And this goes with the regulatory proposal in Canada, in the Canada Gazette Part 1, when it is published for consultation. So we have already done by then prior public consultation. We have identified the issue. We've looked at the elements supporting the fact that we think there's an issue. We've developed a regulatory proposal, and we've done analysis of the costs and benefits. So that's what must be reflected in the regulatory impact analysis statement. We describe the issue as we did in the document that was published in June earlier this year. You'll find also a part where the analysis of benefits and costs is shown. It talks about impact on the environments, the burden on business, also modern treaty implications and international obligations. In this case, with vaping products, we do not have international obligations, but we do for tobacco products. Next slide, please. Alors, la prochaine étape, rédaction et approbation. Je vais commencer en anglais d'abord. So, drafting of regulations. This is something that is done in parallel with the development of the policy of the RIAS. We talk to the lawyers at the Department of Justice. We talk also to the colleagues in Treasury Board secretariats to review all the material. And the bureaucrats do not make the decision. We put together the material. We follow the guidance from Treasury Board Secretariat. They will have comments as the proposal is developed. But first, the package has to go to the Minister of Health. So the Minister of Health will decide if this package goes or not to Treasury Board. So the Minister, his office will be briefed. We'll answer every questions that they have. We'll talk about what were the comments received from interested parties. They may ask for further information or changes on the package sometimes. But once the minister signs off on the package, then it's submitted to the Privy Council office. Privy Council office is like the department that supports cabinet and the Prime Minister. And it's reviewed there before it goes to Treasury Board ministers for approval of the package. How the ministers make their decision is basically looking at the regulatory impact analysis statement, any other briefing material that the Treasury Board Secretariat will have asked. This is why it's very important to have a balanced regulatory impact analysis statement, because on the one hand, in the case of flavor restrictions here, the TB ministers will be interested to know, well, what is the public health problem that needs to be addressed here? They will want also to see what's the evidence that we've put together to support our analysis and the need for regulations. They will want also to see what the consultation has said So the fact that the department consults, it's not necessarily to decide whether or not the package goes forward or not. It's to be able to show in the first hand what to the minister what the impacted Canadians have to say about the regulatory proposal. And it's going to be the same thing for the TB ministers. They want to see what all Canadians have said. So those who are against the proposal, why are they against it? Those who are for the proposal, why they are for it. And there's also the cost and benefits analysis that will help also balance all the key guiding principles that I mentioned earlier. Donc, brièvement en français, pour l'analyse du dossier, c'est important pour le Conseil du Trésor, donc les ministres du Conseil du Trésor, de se fier au document qui est l'analyse d'impact de la réglementation, qui va présenter d'une part les enjeux, l'enjeu, quelles sont les preuves qui justifient notre analyse de l'enjeu. Ensuite, voir quels ont été les commentaires des Canadiens intéressés par ou qui sont concernés par le projet durant la consultation antérieure. Et ensuite, l'analyse des coûts-avantages, ce qui permet au Conseil du Trésor de faire l'équilibre, de pouvoir mettre en parallèle et en contraste les 4 principes directeurs que je viens de mentionner tout à l'heure. Next slide, please. So here are the 2 last steps, if you want, but there are many steps in between 1 and 3 here that you have. So pre-publication took place in June this year, followed by a 75-day consultation. We are currently analyzing those 25,000 comments that we received, most of them from 9 letter writing campaigns, excuse me. If need be, there'll be adjustments made to the proposal, changes, and then the minister will have to consider the regulatory package that will be put together. And if the minister decides that this goes ahead, then we'll have to go to Treasury Board, the ministers again for decision. The step between 1 and 3 here could take anywhere from typically 6 months to 24 months or even longer from past experience. Brièvement en français, donc la publication préalable a eu lieu en juin dernier. La publication définitive va suivre si le Conseil du Trésor éventuellement approuve une nouvelle réglementation, et le travail qu'on fait maintenant, c'est l'analyse des commentaires reçus. Il y aura des ajustements au projet de règlement s'il y a lieu, et ensuite notre ministre devra décider si oui ou non il veut soumettre le dossier réglementaire au Conseil du Trésor. So maybe we can show the last slide here. Won't necessarily go through that in details, but this is more a graphic representation of what I just said about upfront, the consultation, identification of the problem, analysis. Then the regulatory submission is reviewed, the justice colleagues, Treasury Board Secretary colleagues. Then the minister has to approve. It goes to TV ministers for approval. There's publication in Canada Gazette Part 1. Then what we're doing now is updating the proposal. You see the little square that is reddish. This is where we are at now. And then if it goes to approval, then you'll see what the next steps are. Donc, brièvement en français, vous voyez, c'est une représentation graphique des étapes. Je ne vais pas passer en détail ici, mais c'est juste une représentation à au niveau de ce que je viens de vous présenter. So it's 4:35 right now, so I'm going to stop. I think I've taken enough of your time. Thank you.
Perfect. Thank you very much, Denis, for the presentation. So we'll now move to the question and answer session of the agenda. Alors, nous passons à présent à la période de questions et réponses du webinaire. So I do want to start off by saying that we wanted to thank everyone for the questions that were submitted. Je désire tout d'abord vous remercier de vos questions. And I do wanted to note that given the ongoing regulatory development process, we're not in a position to answer all questions in great detail. Alors, veuillez noter que compte tenu du processus continu d'élaboration de règlement, nous ne sommes pas en mesure de répondre à toutes vos questions en détail. Again, the answers will be given solely in English for brevity. Une fois de plus, ces réponses seront uniquement en anglais par souci de concision. Mais cela dit, s'il y a des questions après cet webinaire, vous pouvez nous envoyer un courriel et nous pourrons répondre à vos questions en français. So apologies that we're only doing the responses in English only. We wanted to be concise here. So with that, Laura and I will be taking turns addressing the questions. So now pass the mic over to Laura to address the first theme.
Thanks, Sonia. So I think the agenda is up, which is great. The first group of questions that you sent in related to the theme of vaping, harm reduction, and quitting smoking. So first, I wanted to say we really appreciated hearing from you, and thanks to those of you who provided input during the recent consultations. We all know that tobacco products are harmful and that smoking is the leading preventable cause of premature death and disease in Canada. The Government of Canada is committed to protecting the health of all Canadians, including helping them quit tobacco. I wanted to point out one of the things the Tobacco and Vaping Products Act did was create a legally defined category of vaping products. So we at Health Canada recognize the potential of harm reduction to help people quit smoking, helping those who can't or won't quit using nicotine to identify less harmful options. While quitting smoking is the best thing you can do to improve your health, we recognize that for those people who smoke and completely switch to vaping, vaping is less harmful than smoking. We've said this in the public domain for several years now. Vaping products expose users to far fewer toxic chemicals and substances than conventional cigarettes. However, vaping is not harmless. While it has been with us for more than a decade, it's not a lot of time to generate the kind of evidence that would be needed to support a precise description of the relative risk. As well, the products have evolved and there is a lot of variation in the products and the way people use them. So vaping does have risks, and the potential long-term effects of vaping remain unknown and continue to be assessed. This is one of the reasons that why we at Health Canada, as well as our colleagues at the Canadian Institutes of Health Research, established a scientific advisory board on vaping products. So this board is made up of experts in various disciplines who can speak to the scientific literature on the potential health benefits and harms of vaping products, and then provide recommendations to us here at the department. If you're looking for additional information on vaping and our approach to regulating vaping products, you can find that at canada.ca/vaping. With respect to the consultations that have taken place as part of that process that Denis just walked us through, we're taking into consideration all types of feedback we received, including campaign letters and postcards. It's not uncommon for us to get a higher volume of feedback from letters, postcards, or email campaigns during regulatory consultations. In preparing a summary of the consultation, we often categorize the feedback received by campaign letters, including postcards and unique submissions. But this process just helps us to organize the consultation summary. As Denis said, the government has and will continue to consider your comments carefully as we consider further action to protect the health and safety of Canadians. And now I will turn it over to Sonia for the next batch.
Perfect. Thanks, Laura. And I'll just wait and see if we've got the agenda up for the second theme. I'll go through, I'll get perfect. Thank you. So the second group of questions that you submitted related to regulating vaping flavors. And again, wanted to echo what Laura was saying earlier about thanking everyone for submitting their input to our consultations. Your comments about your experiences are being carefully considered. And so I'll maybe just take a step back for a second to kind of talk about sort of the problem definition that we're facing. So we know that there has been a rapid increase in youth vaping that we've seen not only in Canada, but that has also been seen in the United States. And so while we recognize that there's no single factor that has been responsible for driving that observed increase, there is research in this area that identifies the availability of a variety of desirable flavors as one of the key factors responsible for this increase. So with the proposed regulations for vaping flavors that we just recently consulted on, it's expected to contribute to making these products less appealing to youth. At the same time, the proposed regulations would still maintain access to some flavor categories like tobacco, mint, and menthol. And the reason for doing this was to have flavors on the market available for adults who smoke and who wish to transition or who have already transitioned to vaping. And we do want to continue efforts to help people who smoke to quit and remain smoke-free. One other point that I wanted to raise here as well was just to clarify, in case it's not widely known, is that even if the government were to move forward with proposing restrictions or putting in place restrictions with regards to flavors, this would not apply to vaping products that are submitted under the Food and Drugs Act for a therapeutic use. So for example, submitted for a cessation aid. So I just wanted to highlight that that is an alternative avenue for getting flavored vaping products to adults who want to use them to help stop smoking. To date, though, there haven't been any vaping products that have been authorized under the Food and Drugs Act. Another point I wanted to raise here as well is that at the same time that we launched consultations on restricting flavors in nicotine vaping products, there were also consultations on cannabis extracts in vaping products. So for both these products and nicotine vaping products, we at Health Canada, we're aiming to take a balanced approach that is really to provide access to adult consumers while also taking necessary steps to limit the appeal of these products to youth. And then finally, just wanted to mention that we do all recognize how difficult it can be to quit smoking and the challenges that many people face in dealing with their dependence on nicotine. So while our focus today is to talk about vaping specifically, I did want to take the opportunity to briefly highlight some of the other programs and activities that we offer to support people who smoke or use tobacco. There is a toll-free quit line with trained specialists that can answer questions and provide advice. And we also fund some programs through our community organizations as well. So I won't go into detail here because there's lots of information about this on our website if you are interested in learning more about this. So with that, Laura, I will turn it over to you for the next theme.
Okay, so I think we can see the third group of questions there on the screen. The third group we got relate to vaping compliance and enforcement. One of the questions also refers to sharing information, which we'll get to in a few minutes when I respond to questions about public education. So we have a strong compliance and enforcement program at Health Canada to ensure that manufacturers, importers, and sellers of vaping products comply both with the Tobacco and Vaping Products Act, as well as the Canada Consumer Product Safety Act. So Health Canada inspectors regularly perform inspections of establishments where vaping products are imported, sold, promoted, manufactured, or labeled. To be clear, I just wanted to say it's not illegal for individuals to post about vaping online. Where there are potential compliance issues is a scenario where an individual or organization with a commercial interest contravenes the rules about the promotion of vaping products. So the tagging, quote unquote, of vape shops by consumers on social media may be considered a testimonial or endorsement prohibited by the Tobacco and Vaping Products Act. And that's where vape shop owners' concerns would originate. And these need to be analyzed on a case-by-case basis in order to determine whether the posted material contravenes the promotion restrictions that are in the Tobacco and Vaping Products Act. With respect to the question about unsafe products, the Canada Consumer Product Safety Act prohibits the sale of consumer products that may pose a risk to health or safety. So when we are notified by industry, Canadians, or others that a consumer product like a vaping device or an e-liquid may pose a risk under the Canada Consumer Product Safety Act, we evaluate the risk and follow up as necessary. Health Canada will take compliance and enforcement action as appropriate when we identify a potential danger to human health or safety in a consumer product. Regarding the sale of vaping products to minors, Sections 8 and 9 of the Tobacco and Vaping Products Act restrict access to these products by young persons, which is defined as being under 18 years of age. Some provinces have legislation that restricts sales of vaping products to people who are 19 and older, and PEI, actually, their age requirement is 21, so a bit of difference across the country there. We also work with the provinces and territories in the enforcement of vaping product regulations, and you may wish to inquire with your province, territory, or your municipality for additional information about enforcement actions in your area. If you'd like to know more about the compliance and enforcement activities that we do, we have vaping compliance and enforcement reports, which you can view on our website. And I would say as well that if you notice anything that you think might not be in line with the Tobacco and Vaping Products Act that might be a contravention, please send us an email. We'll put the address in the chat right now because it's a bit confusing to read it. There it is. Thanks very much. So feel free to send us a note and we can follow up with that. Okay, over to Sonia.
Perfect. Thanks, Laura. So the next theme and question relates to the risks of vaping. So I wanted to be very clear here that there have been 0 deaths reported as a result of vaping-related illnesses in Canada. We have seen a small number of issues involving vaping products, but as was mentioned earlier, we're still learning more about how vaping affects health in general, and the potential long-term effects of vaping remain unknown and continue to be assessed. So just wanted to make sure that that was clear as well. So with that, Laura, I will pass it over to you for the last theme.
Okay, so the last question finally we got relates to funds spent on public education campaigns relating to vaping. So the question itself talks about some Senate committee hearings that were taking place a few years ago. So I thought I would just take a minute to give some context. So in 2017, the Standing Senate Committee on Social Affairs, Science, and Technology discussed messaging to the public about the relative risks of vaping products, and in particular, relative risk claims in commercial advertising and the need for such claims to be based on sound evidence. So to address these concerns, the bill that the Senate committee was discussing, what we now call the Tobacco and Vaping Products Act, limits the means of promotion for vaping products. So this is in the act to protect youth and those who do not use tobacco products from inducements to vaping, and to prevent the public from being deceived or misled with respect to health hazards. However, I will add that the Act does allow for flexibility regarding messaging for health benefits or relative risks to align with the emerging scientific knowledge. We know that the public perception of health risks of vaping is somewhat muddled. Our own research through the 2019 Canadian Tobacco and Nicotine Survey found that a majority of Canadians thought that using a vaping device was either about the same as cigarettes in terms of harm or didn't know. So these responses show us as Health Canada that there is a continued need for public education in this area. We have this information on our website, but evidently we have a bit more to do so that Canadians who smoke are aware that while vaping is not harmless, it is less harmful than smoking cigarettes for those people who quit smoking and completely switch to vaping.
Perfect. Thanks so much, Laura. So that ends sort of the question and answer period. So maybe before I kind of going into some closing remarks, I just wanted to make sure that because we're here today to try to help demystify some of the process around the regulatory process. One question that I've received before that I just wanted to make sure that we tackled here was in terms of timing. There seems to be a misconception that January 1st is when flavor restriction would come into place. I saw a media article related to that. And as Denis pointed out in his presentation, there's a multitude of steps that have to occur before publishing final regulations before they're implemented. So just wanted to clarify that January 1st isn't a magical date when things may, when restrictions may occur. So just to be clear, we just wrapped up the consultations in early September. We're going through the analysis process, and there's a number of steps that need to happen before, should we get to that final regulation. So just wanted to clarify that in case it wasn't clear during our session today. So while we may not have gotten to everything today, I just want to reiterate how much we appreciate hearing your comments and knowing what topics are of interest to you. Nous n'avons peut-être pas tout revu aujourd'hui, mais encore une fois, nous apprécions d'entendre vos commentaires et de savoir quels sujets vous intéressent. So I do want to thank you again for being here today and for your attention. En terminant, je tiens à vous remercier de votre présence et de votre attention. And also to let you know that there is more information about the Tobacco and Vaping Products Act, proposed regulations, and other topics on our website. Alors, je voudrais encore une fois faire remarquer que vous trouverez plus d'informations sur la loi sur le tabac et les produits de vapotage, les règlements proposés et d'autres sujets sur le site web de Santé Canada. And please, if you do have any further questions, you can contact Health Canada's Tobacco Control Directorate. Alors, si vous avez d'autres questions, vous pouvez contacter la direction de la lutte au tabagisme à Santé Canada. So just before ending, I do want to turn the mic over to our panelist at Rights for Vapors, just to see if you have any sort of final thoughts or comments for us.
Hi. I walked into this not knowing what to expect, and then kind of dreamt of what I would love to expect. So this kind of fell in the middle. I truly 100% hope that this is a step one of many steps to follow, and they can be baby steps, and we can all take our steps where, oops, there goes my headset, where the consumer can be heard and have a voice and be part, like they are in other drugs in Health Canada when coming up with proposed regulations. I've seen firsthand from so many consumers across this country how they feel not being heard. And today, you guys took a step forward in listening. So I personally appreciate that, and I'm sure others do. We just hope that this isn't the end. We hope that this is the beginning.
Right. Thanks so much, Maria. And I know this was a different format than maybe your other webinars that you've done to help educate and empower your membership. But I do take to heart your words about this being a first step. And again, we do appreciate being here today to talk a little bit more about our process.
Thank you.
Christina,
and I don't know if Christina, I was going to say, I don't know if Christina, but we're thinking exactly the same.
Okay, perfect.
So I'm going to mute.
Okay.
Oui, je voudrais juste un peu dire la même chose que Maria. Pour moi, c'est sûr, je sais que je fais l'écho de probablement des sentiments de plusieurs personnes qui écoutent le webinaire aujourd'hui, et je suis sûre que plein de personnes voudraient comme répondre aux réponses que vous avez données, dans le sens qu'ils ne seraient pas tout à fait d'accord. Bon, pour moi, c'est pas le but de la chose. Comme Maria a dit, c'est important qu'on a commencé le processus. Pour moi, l'ouverture même, c'est un pas dans la bonne direction. Et oui, encore une fois, je vais répéter ce que Maria a dit, que pour moi, l'essentiel dans la réduction des méfaits, on le sait très bien, c'est on doit centrer les voix des personnes directement touchées par la problématique. Dans ce cas-ci, c'est les fumeurs et les anciens fumeurs qui bénéficient de la réduction des méfaits par le biais de sources de nicotine moins nocifs. Ça, j'espère qu'on va voir de plus en plus de la part de Santé Canada et aussi des santé publiques dans les provinces, parce que c'est quelque chose qui manque énormément et je pense que c'est au détriment justement de la santé publique. Je pense qu'à plusieurs niveaux, ce que nous voyons en ce moment pour le vapotage, il y a des parallèles qu'on peut voir entre ça et la manière que l'approche par rapport à la consommation de drogue ou par rapport à l'épidémie du sida et les préjugés et les peurs qui ont souvent place dans ces débats-là, mais qui ont quand même évolué. J'espère aussi que cette évolution-là va avoir lieu dans ce domaine-ci. Et voilà.
Merci beaucoup, Christine. J'apprécie énormément vos commentaires.
Merci.
Thank you so much. Perfect. Great. Well, with that, I again want to thank everyone for attending today. Je vous remercie énormément pour aujourd'hui. So thanks to everyone. And thanks, Maria, for having reached out to organize this webinar to begin with. Much appreciated.
Well, I'd like to thank Maria and Christina too as well on behalf of our viewers for doing such a great job in getting this webinar together. Fantastic and fascinating to see Health Canada be so transparent as they were with the viewer and the consumer here in Canada. Though I do have a question, one that I think needs to be answered, and that's how does this ship get turned around? We understand the process. It seems to be steamrolling right ahead. But, you know, in between there, they were talking about how when it reaches the minister's office, before it goes to the Treasury Board, it sounds like that's a point in which the ship could get turned around. So does that mean, and here's the question, that the politicians have to tell the bureaucrats to turn the ship around? Or do the bureaucrats somehow see the light on this issue and turn the ship around somewhere around in that political area? How does the ship get turned around? And how likely is that in terms of the historical record of regulations as they reach near Gazette 2? It's an interesting question, and we're going to be asking that of our guests over the next couple of weeks. So there you go. That's our quick coverage of the Health Canada webinar. Hope you enjoyed it, and come back soon.